Hi, my name is Camila Andrade, and in this video I'm going to talk about blood pressure screening by outpatient physical therapists, a call to action, and clinical recommendations. Hypertension, HTN, is among the leading global prevalent risk factor of cardiovascular disease and premature mortality. Early detection and effective management of HTN have demonstrated significant results in mortality, morbidity rate, and healthcare costs. Furthermore, screening of HTN by non-physical care provinces provides determination rates and medical management.
How to measure resting blood pressure. The purpose of this test is to measure the pressure in the arteries as the heart pumps. In order to measure blood pressure, you must understand its components and readings. Systolic pressure is the pressure of the blood flow when the heart muscle contracts. It is the top number of your blood pressure reading and is measured when you first hear the knocking sound, also known as court cough. Diastolic pressure is the pressure measured between heartbeats. It is the bottom number of the blood pressure reading and is measured when the knocking sound ends. The blood pressure reading is measured in millimeters of mercury. You'll be needing a stethoscope, a sphygmomanometer attached with a blood pressure cuff. The procedure for this test is as follows. First, palpate for the brachial artery. Place the reference arrow of the blood pressure cuff once you've gotten mental note of the brachial artery. Then wrap the blood pressure cuff around the arm securely. Then place the diaphragm of the stethoscope on the brachial artery. Make sure the knob is turned to avoid any air loss during this process. Now we are ready to take the blood pressure. Always pay attention to the sphygmomanometer. Start by rapidly inflating the blood pressure cuff to 180. From then, slowly release the air pressure, little by little. Take note of when you first hear the knocking sound or the court cough sound. That'll be your systolic pressure. Once that knocking sound ends, that'll be your diastolic pressure. Once finished with this procedure, you may now take off the cuff. The measurement is now complete.
Application in physical therapies. As physical therapists practice advice to a more independent care model, physical therapy may serve as the first point of contact into a healthcare system, thereby necessitating a need for routine blood pressure (BP) modeling. This is especially relevant in the outpatient physical therapist practice setting, where there is evidence of elevated BP emission of among patients, yet omission of routine screening in a setting is a well documentation.
Blood pressure is the measure of force exerted by circulating blood against arterial walls. It is calculated by multiplying cardiac output and total peripheral resistance. It can change in response to activity, nutrition, body size, obesity, health status, and the presence of blood vessel disease. It is internally managed via baroreceptors in large arteries that can detect changes in pressure and inform the central nervous system to release hormones, which constrict or dilate vessels as needed. We find that during exercise or high-stress situations, that heart rate increases, which increases cardiac output, which in turn increases blood pressure. Pressure increases to a much greater extent in response to heavy weightlifting when compared to aerobic training as seen here. The greater increases during weightlifting are caused by factors such as increases in intra-abdominal pressure, compressive forces from muscular contractions, and compression from external elements such as equipment. Think of the leg press. The Valsalva maneuver, which includes holding of one's breath while attempting to move a heavy load to increase stability, should not be performed among those with hypertension or clinical high blood pressure. It is a dangerous strategy for those with blood pressure issues, as it creates a major additional spike in blood pressure combined with a reduction in heart rate, which can cause dizziness, fainting, or even direct vascular damage among those with compromised systems. Interestingly, blood pressure ties in with assessing a client's pulse, as pressure exerted against the arterial wall at pulse assessment locations during each heartbeat is what we feel when we take a resting or exercise measurement. Large arteries close to the skin can be palpated at the head, neck, arm, and leg, but personal trainers primarily use the radial pulse in the lower arm and the carotid pulse at the neck as shown here. Protocol for taking a resting measurement or during training will be described in detail in a later lesson.
Conclusion. Growing evidence supports the need for outpatient physical therapies to regulate screen and access of BP at the rest with exercise. Because the physical therapies are identified as healthcare prevalence with a vision to transform the society by optimizing movement to promote the human exercises.